Well, this is a big day here in Lansing. We hear the vision of our governor, a day when, well, we're facing more of what we've seen this century: declining revenue, red tape, job losses, and a real need for the political will to fix Michigan. The answer to here and for our people starts with honestly identifying the problem and then finding ways to help our people. Realism and not empty promises that drive our children from our shores is in fact what we need. We have a budget hole. We who serve on PROPS are keenly aware of that, and of course our people are aware of it, and everyone in this chamber is aware of it. Our budget by law and by right must be balanced. That means that we can't spend what we do not have. Basic functions like keeping our people safe and safe in their homes are the proper function of government. New spending for new programs is not. I have some thoughts. I hope tonight when our governor speaks that some of these will be mentioned. I believe we need to freeze the EITC, not because we don't want to help the needy, but we cannot afford another $100 million round of additional spending. We need to parole the aged, the blind, and disabled prisoners. Yes, we're mad at them, but their disability means that we are no longer afraid of them. Paroled, they stop consuming in excess of $34,000 a year each, and they become eligible for federal support. Our prison food costs are measured, as it turns out, in the calories provided. We're paying for 2,900 calories per day per prisoner. Florida pays for 2,500. Reducing the calories to a more reasonable number would save us over 10% of the cost to feed 50,000 prisoners. We need more prison infirmary beds. Why? Because when prisoners are taken care of in the prison and in the infirmary, this cuts down hospitalization expenses, which are the most single expensive hospital costs that are faced by our prisons. Mental health needs to be integrated into the total health care of the patient, and this needs to be done for continuity reasons. We need to expand MPRI as this cuts recidivism. Prison libraries need to be replaced by CD-ROMs. The savings here would affect our prisons structurally if we would do them. DHS needs to look at whom we are serving. It makes no sense to have people with $500,000 homes still eligible for their services. Nor should automobiles with $40,000 values be disregarded as assets. Other states have fixed this, and we can too. Proof of residency in Michigan needs to be upgraded. There's talk of a county in Kentucky mostly supporting itself on Michigan Bridges cards. This is truly an outrage. And by the way, speaking of bridges, there are just too many stories about people using them to buy junk food and not staples. We want those eligible for services to get them. But unless we do a better job of appropriate eligibility, we won't have enough for the truly needy. In our universities, we need to look at privatization of services. We are fast approaching $50,000 a year for custodians. This is simply unsustainable. In DCH, we need to call a halt to the single point of entry experiment. It's generated a new bureaucracy, driven up hospital costs, and unfortunately saved nothing. There's more that we could talk about, and I would be delighted to talk to each and every member about this. These ideas are part of what we can do to find hope for our people and the ability to afford Senate Bill number 1.